Shay relaxes by watching a movie.
We distract the patient by getting them to watch DVDs or movies. And this distraction means that we have to give them less medication to sedate them. Single hair follicles will be along this line here. And then in behind this we'll have the 2 hair follicles, then the 3s, and then the 4s in here.
Once the incisions have been made, the team works in rotation to insert the follicle grafts to suit the natural lie of the hair. It's work that requires skill and the kind of patience that comes only with dedication. Some grafts will go in slanted, some will go in straight. The orientation, the way each graft is placed in the scalp, is of great importance.
If you have 2 hairs represented by my 2 fingers, you only really see 1 hair when you're looking at it. But if you orientate it like that, you see 2 hairs. And likewise, if you have 3 hairs, you can see 3 hairs. Whereas in this situation, you only see 1 hair. So by orientating the graft in a particular direction, you get a tremendous feeling of fullness and density. You're maximizing it for the patient.
Shay Dempsey hasn't been unduly upset about his hair loss. As a hairdresser, he wants transplants just to have a little of his own hair to play around with. However, for some men, hair loss is very hurtful.
50% of men by the age of 50 have significant hair loss. And thankfully, the vast majority of men are not in any way disturbed by their appearance when they have hair loss. And that is fine. I'm not setting out to transplant every balding or thinning man in Ireland. But there are a number of people where their self-image is injured by the hair loss that they have, and they want a proper surgical procedure carried out to try and help them with this.
As an ear, nose and throat surgeon, Maurice Collins was well practiced in microsurgery when he decided to apply his skills to follicular unit hair transplants 5 years ago. He saw a need for top-quality hair transplant surgery in this country. However, he believes that the procedure is not right for everyone in every circumstance.
There are some patients who I won't operate on. Young men under the age of 25, in my opinion, should not be operated on. Their hair loss is not yet established in the majority of cases, and I do not think they should be operated on. If they go to commercial clinics, they come under pressure from salesmen who try to sell them a transplant. I think it's absolutely wrong that a salesman should sell a hair transplant to a 21-year-old. It's immoral.
There are many published illustrations of heads before and after follicular unit transplant surgery. The results can be very, very good. However, not all hair transplant providers achieve the same result. Maurice Collins sees many clients who come to him to improve on work done elsewhere.
These large plugs here are very, very unnatural looking, and they take away from the person's appearance. There's no attempt for the hair to angle forward. It's just coming straight, it's springing straight out of the scalp.
Totally unnatural.
Very unnatural, but I'm not being critical. In those days, that was the state of the art, but no longer. This is somebody who had a micrograft operation carried out, and he's meant to have had 1,000 grafts put in, over 1,000 grafts put into this. You can see that there's not 1,000 there. Just eyeballing it, it's between 150 and 200. I honestly think this is really unacceptable.
Maurice Collins also treats female patients for hair loss, including one patient scarred by a burn.
This is scar tissue which behaves differently to normal skin. And we're going to put some test grafts into this, observe them over a 6-month period. If they grow very well and naturally, then we'll transplant all this area here. She's plenty of donor hair, so she should do extremely well.
Meanwhile, work continues on Shay's head. In this session, he'll receive over 1,300 grafts, containing some 4,000 hairs from his own head. The session will cost him €6,000 on top of the $3,000 that he paid for his first session some months ago. For Shay, it's worth every cent, and he even enjoyed the day.
I've got 3 children, so there was nobody bouncing out of me or hanging out of my head, so it was quite nice to watch a movie in peace. It was really enjoyable. Instead of Barney.
Well, that was Shay 5 months ago. We've come into his salon now to catch up with him and with Maurice Collins. And Shay, you've got a great head of hair.
Yeah, thank God. Yeah, I can really see results now. 5 months on, You know, I can feel new hair starting to grow through the hairline, and again, I can actually see a hairline starting to appear, which is great.
And I was wondering, as I was watching that on the film, would you be worried that it might fall out?
No, because again, you know, from talking to Maurice, it's a repositioning of the hair. They've taken the donor hair from the back and they've just put it in the front section, so it should grow out fine.
Mm-hmm. And Maurice, it grows very well.
Yes, it does. Shay made that point that hair at the back of the head is genetically different to hair at this area where he was losing it. And when we move it from the back to the front, it's going to stay there permanently for the rest of his life.
Yeah.
Nobody noticed that they've had a transplant. But people do say you're looking more youthful. I had one man who people thought he'd actually had a facelift. He looked so good. So.
And how young do clients come to you, Maurice?
All age groups. I have a boy aged 19 and I have a man aged 74 who's interested in having his hair treated. I think it's a wonderful attitude to have at that age.
But would a 19-year-old have a hair transplant?
No. I don't like transplanting somebody until the age of 25. But there are medical treatments we can give young people which help them tremendously. Their friends still have their hair and they're losing their hair, and it upsets them greatly. So by giving them medication to take, we can actually reverse some of the hair loss, and it does help them.
And would you always recommend for somebody who finds himself in that position to go to a doctor?
Correct. I don't like the concept of somebody with a cosmetic problem going to a commercial clinic and meeting a salesperson. If you have, say you want your ears reshaped or your nose reshaped, you go along to your doctor and you're referred to a plastic surgeon. And I don't see why people who have a problem with their hair should go along to a salesman. I think it's totally wrong.
For further information on hair restoration, contact this number or visit our website.